Good morning, everybody. I hope you had a wonderful weekend. It's good to be back. This is Monday, the 27th of July, and welcome to our daily COVID meeting. We're going to drill in this morning by starting in what happened in the United States and then in the state of Florida. In the United States, as we enter phase 2, day 52, we broke a new milestone with over 4 million new cases with over 4 million cases of COVID now in the United States and 146,000 fatalities. We had a particularly tough weekend here in the state of Florida. We are up to 423,000 cases, 5,854 deaths, but the number of new cases during the last 48 hours increased by more than 33,000 here in Florida. So those numbers just continue to climb. The governor has been working with the CDC and looking at the projections, and his prediction is that these numbers will continue to go up at an alarming rate as we attempt to regain control of COVID spread here in the state of Florida. Wearing a mask and social distancing is beginning to have some effect, particularly here in Pinellas County. And I wanted to get up to the board and take a look at some early indicators with you. Okay, here in Pinellas County, we have 15,000 cases of COVID. 373 people have lost their life. The testing continues on an upswing. We're over 150,000 tests with a 10% overall infection rate, and our hospitalizations are 1,316, 270 in our specific zip code here within Pinellas County. Let's take a look at this chart. You will note that this is Pinellas County, and we're going to start with this first graph in the corner. This is the number of emergency room visits with influenza-like illness. You can see here at the end of June on the 22nd, we peaked, and it has steadily been going down. So the number of people who are showing up in emergency rooms, acute care centers, urgent care centers with flu-like or COVID-like symptoms has continued to fall here in Pinellas County. The second one is the number of documented new cases. So of these people presenting at hospital, we saw going back to about 615, here's 622 as a reference point. We saw a pretty stable situation for 2 weeks. It spiked a little bit last week before last and then dropped significantly this week. So what that means is the number of people who are presenting with symptoms in our emergency facilities, the number of those that are now confirmed as COVID positive is significantly reduced. Here is the opposite of, if this is the COVID numbers, these are the flu-like numbers. And you can see going back to 622, we've seen a pretty steady decline in the number of non-COVID-like illnesses as well. Is the percent positive for laboratory testing. Right in here is the benchmark. It is set at 10%. We back on 629, 622, we were above benchmark, and throughout the majority of July, we have been able to steadily reduce this number so that the people reporting with positive testing for COVID continues to decline. So even though the numbers for Florida do not look particularly good, we are seeing improvement in Pinellas County, and there are some positive signs that we've been able to get on top of this and prevent the spread of the virus, which means good things for the community. So I'm going to turn next to Leslie, and she's going to update us on the COVID numbers for Regency Oaks.
Good morning, Regency Oaks. Today here for our quarantine list for residents, we do have 21 in independent living, 8 in skilled nursing, and none in assisted living. For our staff under quarantine, we have 12 for independent living, 7 for skilled nursing, and 0 for assisted living. For residents experiencing any COVID-19 or flu-like symptoms or testing in progress, we have 1 in independent living, 0 in assisted living, and 0 in skilled nursing. For employees, we have 5 in independent living, 1 in assisted living, and 0 in skilled nursing. For overall COVID confirmed, we have our 2 previous residents and are currently still 13 employees. For overall testing for residents are 2 positive residents and a negative results of 182. And then for associates, we have our 13 positives and a negative results totaling to 387. Thank you.
So you will recall back on Friday, we talked about how the strategy of the castle and the moat has been really effective in keeping us safe. And it's really amazing to think that, here we are 4.5 months into this virus, and the number of residents here in the independent living who have gotten COVID is still limited to just 1. So pretty significant accomplishment. And I always talk about there were 2 things that I think helped us to be successful in trying to prevent the spread of the virus. And the first is we've really been fanatical about not letting people from the outside community into Regency Oaks because it's the source that is the carrier that will bring it into the community. So our castle moat approach has been really successful there. The other thing that has really made a difference is last year in the fall, we were talking about flu shots, and at Tuesday Talk every week, I was giving you the updated numbers and encouraging you to go out and get your flu shot. We were really successful as a community in getting herd inoculation. We had more than 95% of our residents and our staff who got the flu shot. Now you're probably saying, well, what does that have to do with COVID? Flu shots are not effective with COVID, and you're absolutely right. But here's where it made the difference. Because of our herd inoculation, we really didn't have much of a flu season this year, and so our residents and our staff, we never got sick, we never stressed out our immune systems. We were healthier as a lot going into COVID and less susceptible because of our herd inoculation with flu-like symptoms. So that has been very impactful. And then, of course, the third thing is practicing good social distancing, hand washing techniques, wearing a face mask, and taking our temperatures on a daily basis so that we have that early warning system that is built into our admissions process, access process, coming and going from the community. That has really made a difference as well. So we are getting ready to enter phase 2 for Regency Oaks, and we have several announcements to make in terms of communication. We're going to start with communication. We are changing this up significantly, and I wanted to review it one more time with you today as well. Our 5 thoughts that have been published Monday through Friday every day is now going to be published just on Tuesdays and Thursdays. So we're going from 5 thoughts 5 times a day to 5 thoughts twice a week. Monday, you can look on channel 732 for a COVID update. We will take the latest statistics from the weekend, update you, and share that with you every Monday. On Tuesday, I'm very excited to announce that we'll be back with Tuesday Talk. It is at 10:30 in the town hall. It's limited to 60 people, and everyone will be required to wear masks. But I'm really excited about being able to get back in front of residents and for us to interact and share. And I'm looking forward to a great dialogue, your ideas, and the wonderful questions that you always have. So I hope to see many of you tomorrow at Tuesday Talk. On Wednesday at 10:30 in the South Grand Lobby, Jesse will be back with Housekeeping Matters, and he's looking forward to that as well. And Ricky and Phil will be back Thursday in the Grand South Lobby at 10:30, and they are combining Dish Talk and Menu Chat. Again, these are small group settings, no more than 60, that will be held in large indoor common spaces. So that's the exciting news for residents. Previous to this, we had only allowed large gatherings of 50 to occur outdoors. We are now opening that up so that large indoor gatherings of no more than 60 can occur indoors with proper social distancing and wearing a face mask. And so I'm going to let Tiffany address with you some of the ramifications of that change in her department and some of the good news that she has to share.
Good morning, Regency Oaks. I can't tell you how excited we are that at the community we're going to be picking up our activities and making sure everybody's having a great time. A few activities that we are going to be picking back up starting in August. We're going to be bringing back our wonderful bingo. We have our aqua fitness, Spanish, as well as church with Father Bob. We will be picking up our wing parties. Keep a lookout for those details, as well as an ice cream social, and keep a lookout for the details regarding a wonderful cocktail party this month. Thank you. And just to add on to that, we would like to remind all of our residents, with us picking back up in the community, please remember to wear your mask in all of your open common areas, whether that's the breezeway, the hallways, the elevators. We're really asking for you to be as safe as possible as we make this next initiative to phase 2, as well as Jesse has put out extra stations with hand sanitizers in our activity rooms, our Grand Lobby South, and different corridor areas in the community. Please be sure to use that as much as possible, as well as washing your hands. We really want to keep the community as safe and healthy as possible as we move into this new initiative. Thank you.
Okay, so that concludes our meeting for today. I hope everybody has a safe and wonderful Monday, and we look forward to seeing you tomorrow at Tuesday Talk.